anxiety, stress, trauma. What is the difference between these three terms? We hear them a lot. Well, I'm here to explain a little bit of the difference between all of these three key terms that we often hear. I'm Leah, and I'm a mental health therapist, and I have been for over 15 years, and I also provide trauma-focused yoga. So I know a lot about anxiety, stress, and trauma. So let's get into it. Really, stress, anxiety, and trauma are three things that are all a response in our bodies and our minds to external or internal pressures. At the lowest end of severity, we have stress. And the word stress has a negative connotation, but not all stress is bad. In fact, when we increase our stress from a low level to maybe a mild or moderate level, we can actually focus more. You'll probably find on a day that you're pretty busy at work, you actually get more done. As opposed to a day when you have no stress at all, you have nothing on the schedule, and you're really unproductive. So that just shows that stress can actually be a good thing. However, if we continue to increase that stress from a moderate to a more severe or intense level, then our productivity can become impacted, and we can, of course, have all kinds of symptoms of stress. Stress can cause ongoing health issues, as we know. Blood pressure can increase, heart issues can surface, our ability to sleep gets impaired, we become irritable and snappy. So stress is definitely a normal and healthy part of life, but when it becomes beyond that mild to moderate level, we want to do something to cope to bring that level down. Next, we have anxiety. Now, anxiety, same thing, is not necessarily a bad thing, and everyone on earth has some level of anxiety. However, you're going to be diagnosed with an actual anxiety disorder if the anxiety symptoms impair your ability to function. That's really the key difference between healthy, regular, normal anxiety, even if it's uncomfortable, and clinical diagnosable anxiety. Now, anxiety symptoms can come in different forms. They can be cognitive symptoms, and those are things that are in our mind. So things like catastrophizing, negative intrusive thoughts, excessive worry. Anxiety symptoms can also come in physical symptoms. We'll often feel a tightness in the chest, or our heart rate will feel like it's beating really fast, or we might get gut issues. Those are really common anxiety symptoms in the physical realm. Anxiety symptoms can also be behavioral, so that might be things like social isolation, doom scrolling. It can be difficulty sleeping, not eating, or eating too much. And finally, we also have emotional symptoms of anxiety, which include, similar to stress, irritability, but also a sense of impending doom and fear that might not even have a clear external cause. And finally, we have trauma. Now, trauma, I could give a 45-minute talk or longer on trauma. And to keep it simple, trauma is the event. Trauma can be a big T, which is a large event where we actually fear for our life or our safety, or a little t event, which might be something like a car accident that was mild or minor. And the trauma itself is the event, but what really gets us is the response, living with the trauma and how it affects us. And trauma can affect us in so many different ways. It can actually change the structure of the brain. So we can actually develop what's called post-traumatic stress disorder, or PTSD, and this is where the clinical side comes in. Some symptoms of PTSD, which again impair our functioning, which is the difference between experiencing a negative event and actually having a clinical diagnosis, can be things like recurring nightmares, re-experiencing the trauma. It can change the way that we relate to other people, our attachment style. Trauma, the event, can actually come in the form of complex trauma, which happens when our trauma occurs during childhood or developmental years, or if they involve our caregivers. When trauma happens with our caregivers, again, it changes the way that we attach to people, which can impact us in every realm of our life because we're social creatures. And so with PTSD, there are many different forms of treatment. However, it's a long-term treatment typically. It takes time to rewire the brain, to change our behaviors, and to live a healthy life even with that past trauma. Some common treatments for PTSD include talk therapy, EMDR, which stands for eye movement desensitization reprocessing therapy. You can do yoga and somatic experiencing. There's medication. There's TMS, which is a brain stimulation. There's ketamine therapy. I could go on and on. There's a lot of different treatments for PTSD. And most of the time, depending on how severe the trauma is, the more detailed the treatment, the more effective you're going to be. Because these treatments can hit on the cognitive level with our thinking, the physical level with our brain chemistry and with our hormones, and then also on the physical level to readjust that nervous system. So that's the quick and dirty of what's the difference between stress, anxiety, and trauma. If you have any questions about this, please leave them in the comments, and I would love to make more videos to explain.